Comprehensive NCLEX RN Practice Exam 2. Question 1. A 28-year-old male has been found wandering around in a confusing pattern. The male is sweaty and pale. Which of the following tests is most likely to be performed? First, A. Blood sugar check. B. CT scan. C. Blood cultures. D. Arterial blood gases. The symptoms of sweating, pallor, and confusion are classic signs of hypoglycemia. A blood glucose check is the fastest and most critical priority to rule out a life-threatening low sugar level. Question 2. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of toilet training? A. The age of the child. B. The child's ability to understand instruction. C. The overall mental and physical abilities of the child. D. Frequent attempts with positive reinforcement. Toilet training success depends on both physiological readiness, sphincter control, and psychological/mental readiness, ability to follow directions and communicate needs. Question 3. A parent calls the pediatric clinic and is frantic about the bottle of cleaning fluid her child drank for 20 minutes. Which of the following is the most important instruction the nurse can give the parent? A. This too shall pass. B. Take the child immediately to the ER. C. Contact the poison control center quickly. D. Give the child syrup of ipecac. The Poison Control Center provides the most specific and up-to-date guidance for specific chemical ingestions. Parents should always contact them before inducing vomiting or attempting home remedies. Question 4. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? A. Gluteus maximus. B. Gluteus minimus. C. Vastus lateralis. D. Vastus medialis. The vastus lateralis, lateral thigh, is the preferred site for intramuscular injections in infants because it is the most developed muscle and lacks major nerves and blood vessels. Question 5. A nurse has just started her rounds delivering medication. A new patient on her rounds is a 4-year-old boy who is nonverbal. This child does not have any identification on. What should the nurse do? A. Contact the provider. B. Ask the child to write their name on paper. C. Ask a coworker about the identification of the child. D. Ask the father who is in the room the child's name. If a patient cannot self-identify, nonverbal/child, and lacks an ID band, a parent or legal guardian present in the room can provide a reliable second identifier. Question 6. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's lab results would expect which of the following changes in laboratory findings? A. Elevated serum calcium. B. Low serum parathyroid hormone, PTH. C. Elevated serum vitamin D. D. Low urine calcium. Hyperparathyroidism causes overproduction of PTH, which leads to the mobilization of calcium from the bones into the blood, resulting in hypercalcemia, elevated serum calcium. Question 7. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended? A. A diet high in grains. B. The diet with adequate caloric intake. C. The high-protein diet. D. A restricted sodium diet. Patients with Addison's disease have a deficiency in mineralocorticoids, leading to sodium loss, hyponatremia. They generally require a high-sodium diet, so restricting sodium is contraindicated. Question 8. A patient with a history of diabetes mellitus is on the second postoperative day following cholecystectomy. She has complained of nausea and isn't able to eat solid foods. The nurse enters the room to find the patient confused and shaky. Which of the following is the most likely explanation for the patient's symptoms? A. Anesthesia reaction. B. Hyperglycemia. C. Hypoglycemia. D. Diabetic ketoacidosis. In a diabetic patient who is post-op and unable to eat, NPO or low intake due to nausea, confusion and shakiness are hallmark signs of hypoglycemia, low blood sugar. Question 9. A nurse assigned to the emergency department evaluates a patient who underwent fiber optic colonoscopy 18 hours previously. The patient reports increasing abdominal pain, fever, and chills. Which of the following conditions poses the most immediate concern? A. Bowel perforation. B. Viral gastroenteritis. C. Colon cancer. D. Diverticulitis. Increasing abdominal pain, fever, and chills following an invasive bowel procedure like a colonoscopy are classic indicators of bowel perforation, a surgical emergency. Question 10. A patient is admitted to the same-day surgery unit for a liver biopsy. Which of the following laboratory tests assesses coagulation? Select all that apply. A. Partial thromboplastin time. B. Prothrombin time. C. Platelet count. D. Hemoglobin. PTT, point, and platelet count are all essential for assessing the blood's ability to clot before an invasive procedure like a liver biopsy. Hemoglobin measures oxygen carrying capacity, not clotting. Question 11. A nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? A. Sexual contact with an infected partner. B. Contaminated food. C. Blood transfusion. D. Illegal drug use. Hepatitis A is primarily transmitted via the fecal-oral route, often through contaminated food or water. Question 12. A leukemia patient has a relative who wants to donate blood for transfusion. Which of the following donor medical conditions would prevent this? A. A history of hepatitis C 5 years previously. B. Cholecystitis requiring cholecystectomy 1 year previously. C. Asymptomatic diverticulosis. D. Crohn's disease in remission. A history of hepatitis C, a bloodborne pathogen, is a permanent disqualifier for blood donation to prevent transmission to the recipient. Question 13. A physician has diagnosed acute gastritis in a clinic patient. Which of the following medications would be contraindicated for this patient? A. Naproxen sodium, naproxen. B. Calcium carbonate. C. Clarithromycin, Biaxin. D. Furosemide, Lasix. Naproxen is an NSAID that can irritate the gastric mucosa and worsen inflammation or cause bleeding in patients with acute gastritis. Question 14. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? A. The patient must maintain a low-calorie diet. B. The patient must maintain a high-protein/low-carbohydrate diet. C. The patient should limit sweets and sugary drinks. D. The patient should limit fatty foods. Cholecystitis, inflammation of the gallbladder, requires a low-fat diet because fat intake triggers gallbladder contraction, which causes pain and inflammation. Question 15. A patient admitted to the hospital with myocardial infarction develops severe pulmonary edema. Which of the following symptoms should the nurse expect the patient to exhibit? A. Slow, deep respirations. B. Stridor. C. Bradycardia. D. Air hunger. Pulmonary edema causes fluid to fill the alveoli, severely impairing gas exchange. This leads to air hunger, extreme dyspnea, and anxiety. Question 16. A nurse caring for several patients in the cardiac unit is told that one is scheduled for implantation of an automatic internal cardioverter defibrillator. Which of the following patients is most likely to have this procedure? A. A patient admitted for myocardial infarction without cardiac muscle damage. B. A postoperative coronary bypass patient, recovering on schedule. C. A patient with a history of ventricular tachycardia and syncopal episodes. D. A patient with a history of atrial tachycardia and fatigue. AICDs are indicated for patients at high risk for sudden cardiac death, particularly those with life-threatening ventricular arrhythmias like VT or VF. Question 17. A patient is scheduled for a magnetic resonance imaging (MRI) scan for suspected lung cancer. Which of the following is a contraindication to the study for this patient? A. The patient is allergic to shellfish. B. The patient has a pacemaker. C. The patient suffers from claustrophobia. D. The patient takes antipsychotic medication. The strong magnetic field of an MRI can interfere with the function of a pacemaker or cause movement of metallic internal components, making it a strict contraindication. Question 18. A nurse calls a physician with the concern that a patient has developed a pulmonary embolism. Which of the following symptoms has the nurse most likely observed? A. The patient is somnolent with decreased response to the family. B. The patient suddenly complains of chest pain and shortness of breath. C. The patient has developed a wet cough and the nurse hears crackles on auscultation of the lungs. D. The patient has a fever, chills, and loss of appetite. The classic presentation of a pulmonary embolism is a sudden onset of pleuritic chest pain, dyspnea, shortness of breath, and tachypnea. Question 19. A patient comes to the emergency department with abdominal pain. Workup reveals the presence of a rapidly enlarging abdominal aortic aneurysm. Which of the following actions should the nurse expect? A. The patient will be admitted to the medicine unit for observation and medication. B. The patient will be admitted to the day surgery unit for sclerotherapy. C. The patient will be admitted to the surgical unit and resection will be scheduled. D. The patient will be discharged home to follow up with his cardiologist in 24 hours. A rapidly enlarging AAA is at high risk for rupture, which is a fatal event. Immediate surgical resection or endovascular repair is the standard of care. Question 20. A patient with leukemia is receiving chemotherapy that is known to depress bone marrow. A CBC, complete blood count, reveals a platelet count of 25,000/microliter. Which of the following actions related specifically to the platelet count should be included in the nursing care plan? A. Monitor for fever every 4 hours. B. Require visitors to wear respiratory masks and protective clothing. C. Consider transfusion of packed red blood cells. D. Check for signs of bleeding, including examination of urine and stool for blood. A platelet count of 25,000, thrombocytopenia, puts the patient at high risk for spontaneous bleeding. Monitoring for occult and overt blood is a priority. Question 21. A nurse in the emergency department is observing a 4-year-old child for signs of increased intracranial pressure after a fall from a bicycle, resulting in head trauma. Which of the following signs or symptoms would be cause for concern? A. Bulging anterior fontanelle. B. Repeated vomiting. C. Signs of sleepiness at 10 p.m. D. Inability to read short words from a distance of 18 inches. Repeated vomiting is a classic sign of increased ICP in children. The anterior fontanelle closes by 18 months, so it would not bulge in a 4-year-old. Question 22. A non-immunized child appears at the clinic with a visible rash. Which of the following observations indicates the child may have rubella, measles? A. Small blue-white spots are visible on the oral mucosa. B. The rash begins on the trunk and spreads outward. C. There is low-grade fever. D. The lesions have a / teardrop on a rose petal / appearance. Colic spots, small blue-white spots on the buccal mucosa, are a pathognomonic early sign of rubella, measles. Question 23. A child is seen in the emergency department for scarlet fever. Which of the following descriptions of scarlet fever is not correct? A. Scarlet fever is caused by infection with group A Streptococcus bacteria. B. / strawberry tongue / is a characteristic sign. C. Petechiae occur on the soft palate. D. The pharynx is red and swollen. While petechiae can occur in various throat infections, they are not the defining clinical characteristic of scarlet fever, whereas strep A, strawberry tongue, and a red pharynx are classic. Question 24. A child weighing 30 kilograms arrives at the clinic with diffuse itching as the result of an allergic reaction to an insect bite. Diphenhydramine, Benadryl, 25 mg 3 times a day is prescribed. The correct pediatric dose is 5 mg/kg/day. Which of the following best describes the prescribed drug dose? A. It is the correct dose. B. The dose is too low. C. The dose is too high. D. The dose should be increased or decreased, depending on the symptoms. 30 kilograms x 5 mg/kg/day equals 150 milligrams total daily dose. The child is receiving 25 milligrams x 3 equals 75 milligrams daily. 75 milligrams is exactly half of the recommended daily dose. Question 25. The mother of a 2-month-old infant brings the child to the clinic for a well baby check. She is concerned because she feels only one testis in the scrotal sac. Which of the following statements about the undescended testis is the most accurate? A. Normally, the testes are descended by birth. B. The infant will likely require surgical intervention. C. The infant probably has only one testis. D. Normally, the testes descend by 1 year of age. Cryptorchidism, undescended testes, often resolves on its own. Most testes will descend spontaneously by the time the infant is 1 year old. Question 26. A child is admitted to the hospital with a diagnosis of Wilms tumor, stage 2. Which of the following statements most accurately describes this stage? A. The tumor is less than 3 centimeters in size and requires no chemotherapy. B. The tumor did not extend beyond the kidney and was completely resected. C. The tumor extended beyond the kidney but was completely resected. D. The tumor has spread into the abdominal cavity and cannot be resected. In stage 2 Wilms tumor, the cancer has spread beyond the kidney to nearby tissues, perirenal fat or blood vessels, but can still be completely removed by surgery. Question 27. A teen patient is admitted to the hospital by his physician who suspects a diagnosis of acute glomerulonephritis. Which of the following findings is consistent with this diagnosis? Select all that apply. A. Urine-specific gravity of 1.040. B. Urine output of 350 milliliters in 24 hours. C. Brown, // urine. D. Generalized edema. Tea-colored urine due to hematuria, blood in the urine, is a hallmark sign of glomerulonephritis, often following a strep infection. Question 28. Which of the following conditions most commonly causes acute glomerulonephritis? A. A congenital condition leading to renal dysfunction. B. Prior infection with group A streptococcus within the past 10 to 14 days. C. Viral infection of the glomeruli. D. Nephrotic syndrome. Acute post-streptococcal glomerulonephritis, APSTN, is the most common form, occurring shortly after a throat or skin infection with strep A. Question 29. An infant with hydrocele is seen in the clinic for a follow-up visit at 1 month of age. The scrotum is smaller than it was at birth, but the fluid is still visible on illumination. Which of the following actions is the physician likely to recommend? A. Massaging the groin area twice a day until the fluid is gone. B. Referral to a surgeon for repair. C. No treatment is necessary, the fluid is reabsorbing normally. D. Keeping the infant in a flat, supine position until the fluid is gone. Congenital hydroceles usually resolve spontaneously by 1 year of age as the fluid is reabsorbed. Reduction in size indicates normal resolution. Question 30. A nurse is caring for a patient with peripheral vascular disease, PVD. The patient complains of burning and tingling of the hands and feet and cannot tolerate touch of any kind. Which of the following is the most likely explanation for these symptoms? A. Inadequate tissue perfusion leading to nerve damage. B. Fluid overload leading to compression of nerve tissue. C. Sensation distortion due to psychiatric disturbance. D. Inflammation of the skin on the hands and feet. PVD causes chronic ischemia. When nerves are deprived of oxygen and nutrients due to poor perfusion, it leads to peripheral neuropathy characterized by burning, tingling, and hypersensitivity.